centers. Like,
Well, as far as I know, there's not too much interest in prescribing Vanco for PSUs in Canada, either adult or, well, I know Dr. Eckstein is participating in this trial. Was. So there's interest on a research level, but not with the
They have a couple
action.
kids from Toronto that are on Vanco that I've seen, so, that have responded, so.
I mean, you should talk to Simon about getting this. No, he doesn't want to.
Well, I mean, it's case by case, but there's a lot of patients who are reaching out to me as a representative of the patient group saying, we can't get it.
Well, but on the other hand, if you look at the amount of, randomized controlled studies in peds, there's not very much.
Yeah, of course.
And so, Vanco is expensive, so of course the government's not going to.
The government's not paying for it. It's them paying for us. They're going to pay for care.
No, but OHIP pays for
No, medication. There's no national farm care.
Yeah, but you only pay a certain fraction.
Well, I know because I'm begging on for it.
Right, but that, no, but there are other drugs. The reason you may end up paying for it is because there are some drugs up in Canada that are covered completely. I mean, I grew up there, I know that, I practiced there, that are covered, but the drugs that have not been approved, you have to pay out of pocket. And so I think, putting patients on without having a randomized controlled study with larger numbers, they're going to say, well, where's your proof? I mean, they make any other drug coming out. The reason that Vanco is accessible is because it's used to treat other things. So, it's not like a new drug coming to the FDA or the equivalent in Canada. So if you don't have that proof, then you're not going to get approval.
Right.
And so that's why it's difficult to get a hold of now. I think, there needs to be some studies, is the bottom line.
The bottom line is how do we all make that happen?
Well, I think that the suggestion that you guys had for having the network for the pediatric, and there could be for adult as well, where the study is, there's a protocol that's followed by all of the different institutions. We could get the recruitment done pretty quickly.
The UK has a child liver foundation, which is a group that takes all of the pediatric patients.
Yeah.
That with parents that are interested in having their data, their children, their support groups, and what have you. I think that if we're going to study this long term, you have to have a blood bank where you keep the blood for DNA analysis and genome studies. And I think there will have to be also microbiome before, during, and after treatment, whatever,
Right.
done.
I mean, and, in North America, actually, it's larger than North America, but if you look at SPLIT, which is Studies in Pediatric Liver Transplantation, Toronto's involved in that, we're involved in that, there's a bunch of centers, pediatric centers, because there's never enough numbers to look at, treatment for rejection or anything else. It has to be a multi-center thing. And now part of SPLIT includes Australia, New Zealand, and so if you get a similar group like that, then these studies would be doable, and then you would have evidence that, then you wouldn't have to pay out of pocket for vancomycin. But that's the problem, is that right now for the governments to make a decision about using this, they go, well, I have a few cases here, a few cases there. It needs to be a multi-center randomized controlled trial looking at the benefit. And I think to do that, at least in peds, because no one center has enough, it has to be a multi-center, but it can be done because they've done it in SPLIT.
Do we know which centers have which number of patients?
Well, I have a list for the ones that were participating in PCORI back when so I know as of that period of time when we were about a year ago, I know how many patients there are in the centers. And so that was about 13 centers.
But I think there's, because I was using it in Delaware when I was there.
Yeah. Oh, well, this is just the number of patients and the number of patients who are on, how many of those were on vancomycin, like Philadelphia had 5 versus 40 patients.
Why would Philadelphia have only 5?
on vanco.
Yeah, versus all of their patients.
Those are probably the patients whose parents were advocates and trying to get them put on it.
Absolutely.
So there's a resistance unless the parents are really pushing,
Like me.
like me.
It's really hard to get someone to agree to give your child vanco.
Well, I had
Well, I
one,
didn't have to be I mean,
I had one patient from Philadelphia that had 2 liver transplants for PSC, came to me, put on Vanco because the second liver transplant had recurrence PSC, got better, and I think that influenced them to think about it.
But I think until you actually have these studies, you know, the one off here, the one off there, it's just not gonna be the same thing.
It's not gonna be the first line of treatment, like
can we get you
we have
right
40
on?
patients at our center. My son is treated, and
Yeah.
only like
But
3 or 5 of them
we're gonna
are
try to
treated
trouble
with
check.
vanco.
No, I gotta get a multi-center study.
Yeah, I mean, and the
Really
patients
important.
and parents want data evidence as well.
Oh,
We're
yeah,
not
for
happy
sure.
that
Yeah,
this
I'm like-
this will be our only choice
No,
without that
I
evidence.
agree with that.
No, and I think that's why, you know, it's done with split, and I know, like, my colleague in Miami's using Vanco. I was using it when I was in Delaware, so there are, you know, because,
There may be other centers using Vanco, but not advertising it or not.
right,
I've got a running list
But
of
they,
doctors
but they,
who will
maybe
prescribe
they
it.
have to participate
And when
in the
patients
randomized
contact me,
controlled
I've
trial.
got, my list of where you
SICKIDS is
can
all
go.
about evidence-based medicine.
I'll share it with you, maybe you can add to it.
I guess-
We were just having anybody
Share it
who,
with
if you could,
Catherine. She's gonna be.
okay, all right, well, and I'll talk to you. I'd like to get your emails, we're gonna try to publish an article on this conference right now, so at least we'll get, we weren't on the agenda, but.
Thank you.
Yeah.
Now.
Yeah.
Thank you.